We know what the problem is. You've heard the facts and figures time and again. This involves so many partners from so many parts of society. And it's easy to step back and ask, how did we get here? Food is ubiquitous, particularly unhealthy food, and the need to be active is scarce or almost absent. And in fact, today we have a society where some people have said that physical activity has been engineered out of our lives. This is not just a health issue, it's an economic issue with billions of dollars in costs burdening the healthcare system. And more recently, we've come to recognize it even as a national security issue. 1 in 4 young Americans are ineligible to join the military because they're overweight or obese. Of course, we should start with providers, physicians, practices in doctors' offices, but we also have to work and reach out to places where people live, labor, learn, play, and pray. Several years ago, we unveiled Healthy People 2020. What are our goals for the next decade? We need 2020 vision for a healthy people. There are 4 overarching goals. First, to improve quantity and quality of life. Secondly, to eliminate disparities. Third, that we need to create healthy environments where, in essence, the healthy choice is the easier choice. And fourth, this has to be a commitment across the lifespan, from birth to death. In fact, before birth to death, with healthy moms. Also, this key theme of integration of clinical medicine and public health. These are worlds that used to be completely separate, and now that we're talking more about coordinated care, about quality of care, about integrating clinic and community, that we have models like patient-centered medical homes and accountable care organizations. We are doing this work, of course, in the context of health reform, which is absolutely historic, absolutely transformative. And this is a critical time to talk about health reform, not just for its potential for better insurance and better care, but also better prevention and public health. Let's move active schools. It's not just about PE, but it's about breaks during recess, just encouraging creative ways for students and teachers and staff to be involved. I hope all of you are familiar with the historic Healthy Hunger-Free Kids Act of 2010 and the dramatic change in national school lunch and school breakfast programs, recommendations for all people to increase fruit, vegetable, whole grain, seafood intake, and decrease sodium, saturated fat, trans fat, added sugars. USDA, of course, has put out on my plate to make this as concrete as possible for people. Healthy Base Initiative. So again, place matters, and leadership from the Department of Defense, led by Dr. Woodson, have announced that they want military sites to be healthy places where healthy choices are encouraged. I know so many of you have contributed to so many of these themes and much more, and we are beginning to see glimmers of hope that we are making some progress here. We are seeing some new hope in areas where there was no hope. Nothing can be more meaningful than appreciating the gift of health.